trickle in. Good morning, good afternoon, and good evening to all our participants who are joining us from various time zones. We are thrilled to have you all join us for this program and are grateful to our esteemed speakers to take time out of their busy schedule to share their stories with us. All those who have joined us for the program today are aware of the severe health impacts of air pollution and the importance of clean air for a healthy life. However, unfortunately, over 90% of the world breathes dangerously polluted air. Today's webinar is not to discuss how bad the air is, but it is to be inspired by how amazing the initiatives to achieve clean air across the world are. These initiatives are fast. By fast, I mean they have far-reaching actions and sustained transformation. Today's webinar is being organized by Lung Care Foundation in partnership with US Mission to India. Before we move into the program, I would like to take some time to introduce Lung Care Foundation and the initiative under which the webinar is being organized. Lung Care Foundation is a social impact trust working towards care and cure of 2.6 billion lungs in India. Since our inception in 2015, we have addressed over 200,000 individuals, reached over 100 million individuals through videos, created a Guinness World Record, set up a national network of committed healthcare professionals advocating for clean air and climate action, another network of school and college students working towards clean air and climate action. Over the last 2 years, during COVID-19, Lung Care Foundation has organized over 120 webinars attended by 43,000 participants from 25 plus countries. We also worked on COVID relief, in which we distributed medicines and masks to over 200,000 individuals across 40 cities in India with help of 20 grassroots partner organizations. This webinar is being organized as part of a multi-year initiative supported by US Mission to India. Saaf Hawa or Nagrik, which in English translates to clean air and citizen, is an initiative to make active efforts to educate and engage the public on air quality for better health. Through the program, we have engaged various stakeholders through programs such as with resident welfare associations, college and school students, policymakers, and many others. Prior to this, we have also organized 2 regional South Asian dialogues with leaders of air quality initiatives from countries across South Asia. With further ado, I would now like to invite Gloria Berbena, Minister Counselor for Public Diplomacy at US Mission to India. Gloria joined the US Diplomatic Corps in 1989. A member of the Senior Foreign Services, Gloria assumed her current posting as Minister Counselor for Public Affairs to US Mission to India in October 2021. She previously served as Charge d'Affaires and Deputy Chief of Mission at US Embassy in San Jose, Costa Rica, as Minister Counselor for Public Affairs at US Embassy in Rome, as Senior Advisor to the Executive Secretary in Washington, D.C., Executive Assistant and Chief of Staff to Under Secretary for Public Diplomacy and Public Affairs, and as Director of Office of Public Diplomacy in the Bureau of European and Eurasian Affairs. Other overseas service includes public diplomacy positions in Havana, Athens, Naples, Rome, and Bangkok. I'm pleased to invite you for the opening remarks, Gloria.
Thank you so much, Abhishek, for your kind welcome and for setting the stage for today's webinar. I'm so delighted to be joining you all today. The US Mission to India has had a long and productive relationship with the Lung Care Foundation, one that stretches back years now. As someone who arrived in India only a few months ago, I'm very pleased to be a part of this ongoing effort to help promote clean air practices and policies. This is just part and parcel of US efforts to combat the climate crisis and a key priority of ours at the embassy in New Delhi and at each of our 4 consulates. We are working with organizations such as the Lung Care Foundation, along with community leaders, schools and universities, politicians and journalists, anybody really who uses their influence and voice to improve the environment. And I'm so pleased that as part of our ongoing relationship, the Lung Care Foundation has amplified the reach of its messaging campaign to improve air quality through print and social media, murals, billboards, and videos. I'd like to add my warm welcome to the panel today. Each one of you and each one of your organizations demonstrates exemplary leadership through the innovative programs, initiatives, and campaigns you conduct to improve air quality and the environment in your countries. The results of your efforts help improve the health of thousands of people across the globe, especially the most vulnerable, women and children in underserved communities, and those living on the margins of society, those who are most susceptible to poor health outcomes or who bear the brunt of climate change. I'm reminded of what President Biden said at the 26th conference of the parties in Glasgow. He said, "Let this be the start of a decade of transformative action that preserves our planet and raises the quality of life for people everywhere." Those words and that vision are what really guides the efforts in the United States. The success of initiatives to improve air quality will depend on the collective action of policymakers, industry, civil society, educators, members of the media, influencers such as yourselves, and frankly, the small everyday choices that we all make. As countries around the world take on the pressing task of improving air quality, we are reminded that everyone, each individual and each institution, public and private, has a role in mitigating hazardous pollution and doing their part towards creating and implementing long-term climate solutions. We need a sense of urgency and commitment to tackle this environmental challenge. Individually and as communities, we must ensure the health of the planet in order to protect present and future generations and the economic prosperity of our countries. For its part, the United States is committed to increasing efficiency and practicing the resilience required to be a global leader in modeling sustainability. One example of our efforts is President Biden's direction to federal officials to devise plans for converting all federal, state, and local fleets to clean and zero-emission vehicles. Another is seen in President Biden's move to end fossil fuel subsidies, focusing instead on increasing the availability of renewable energy. While we all know that air pollution and hazardous air quality are threats to human health, some grim statistics bear repeating. It has been estimated that nearly 7 million people die each year from air pollution. That comes out to about 10% of worldwide deaths. But working to improve air quality to prevent those untimely deaths does not have to come at the cost of economic growth. Since the Clean Air Act was enacted in 1970, US emissions of the 6 most common air pollutants dropped by an average of 70%, that's 70%, by 2015. During this time, the US GDP, on the other hand, grew by 246%, showing that clean air and development can happen simultaneously. The State Department is working with the US Environmental Protection Agency, EPA as we all know it, to help partner governments around the world improve air quality for their citizens. In India, the US Agency for International Development is investing nearly $20 million over the next 5 years towards supporting regulatory reform and broad citizen engagement so that we can drive social and behavioral transformation and achieve maximum impact for those most affected by air pollution. Our health and human services agencies, including the Centers for Disease Control and Prevention and the National Institutes of Health, have been working closely with Indian partners to cut down emissions and fund research to understand and address the determinants of poor air quality. All these initiatives will not only reduce the deadly impact of air pollution on health and the economy, but will also mitigate climate change, which is at the center of US foreign policy, diplomacy, and national security. As we imagine the future, the US mission to India looks forward to building strong partnerships with leaders such as yourselves. We hope to continue to support programs and initiatives that lead to cleaner air, economic benefits for communities, and good health for all. Thank you, and I look forward to hearing from you all, my co-panelists, as you present innovative campaigns and initiatives for clean air and climate action. Finally, my very special thanks to the entire Lung Care Foundation team for putting together this webinar, especially Rajiv, Abhishek, Tulika, and Hamid. Thank you all very, very much.
Thank you so much, Gloria. Thank you for your kind words, and thank you so much to the US mission to India to support this very important program of educating the public on air quality. I would now like to introduce our keynote speaker, Gary Cohen, the president and founder of Healthcare Without Harm. Gary has been a pioneer in environmental health movement for more than 35 years. He has helped build coalitions and networks globally to address health impacts related to climate change and toxic chemical exposure. Gary started Healthcare Without Harm in 1996 to help transform the healthcare sector to be environmentally sustainable and support the health and climate resilience of the communities they serve. Since its inception, the nonprofit has grown to lead and partner in groundbreaking initiatives in more than 72 countries. Gary was awarded the Champion of Change Award for Climate Change and Public Health by the White House in 2013. And in 2015, he also received a MacArthur Fellowship and a Genius Grant Award from the MacArthur Foundation. I had the good fortune to meet Gary for a dinner conversation in 2019, and I was personally very inspired and moved by how he has mobilized partners across 70 countries to work towards their common goal. Gary, it is my honor to invite you for the keynote address on building partnerships for successful campaigns for clean air and sustained transformation.
Thank you so much, Abhishek, and thanks everyone for being here today. I'm going to provide a little context for our conversation for the other panelists today. I first learned about air pollution in its extreme form from the Bhopal chemical disaster. In December 1984, a Union Carbide pesticide factory exploded, sending a poisonous cloud across the entire city of Bhopal, killing 3,000 people in one night and impacting the health of 500,000 other people. The recognition back in our country, United States, that the same thing could happen in the United States led to a national campaign focused on the community right to know. The right to know about the chemicals in our air, in our water, in our neighborhoods. This effort was led by people who had no money. It was moms and dads. They had no technical expertise, and they were often up against the most powerful companies in their communities. But they were defending their kids' health. They wanted to know why their children woke up choking at night and had weird skin rashes after they took a bath, or why they had developed some rare form of cancer. With this mobilization of average citizens in the United States, the Community Right to Know law passed and into the fall of 1986, and it required polluting companies to report their toxic emissions to the air, to the water, and to the land. And it also established a really important principle called the polluter pays principle, which means that if a company is polluting the area, polluting the air, polluting the water, they should be paying for that damage. For several years, I worked at an organization that provided legal, technical support for these communities to address their pollution. And in the mid-1990s, there was new science developing around chemical exposure, which was going to transform the way we thought about it and regulated it. It wasn't the dose that made the poison, but the timing. Scientists were telling us that for the developing child in the womb and in the first 1,000 days of life, there is no safe dose, because incredibly minute levels of toxic chemicals can interfere with the normal functioning of the hormone system, just as critical systems of the body are developing. So two of the poster child chemicals related to this new science were dioxin and mercury. Dioxin being a potent carcinogen that's produced as a byproduct of manufacturing chlorinated pesticides and PVC plastics, and a byproduct of then burning them. And mercury, we know, is linked to neurological damage. And the government was saying, the US government, the Center for Disease Control, was saying that children in the United States were being born with enough mercury in their bodies that it could damage their ability to learn. It could damage their IQ. At the very same time, the Environmental Protection Agency reported that medical waste incinerators were the largest air pollution source of dioxin in the country, and a significant source of mercury. This was all because of all the PVC plastic medical equipment that was being burned in incinerators, and the broken thermometers that were thrown in incinerators and also burned. These pollutants don't get destroyed, but they get transported through the air and onto the land and water and into our food. In the case of dioxin, into the meat and milk products. in the case of mercury, into the fish with millions of people eat. So this was an amazing wake-up call for me and many other folks in the environmental health community. If hospitals were major sources of air pollution, contributing to the very diseases they were treating in their facilities, what hope would we have to support the health of people in our communities? We realized we needed to educate the healthcare sector about environmental health issues, to get them to clean up their house, their facilities, and then educate the rest of society to accelerate the transition away from toxic chemicals and fossil fuels. That was the reason we started Healthcare Without Harm. When we started, there were 4,500 medical waste incinerators in the United States. Mercury was the gold standard for measuring body temperature. But we taught the healthcare sector how to better manage their waste, how to reduce what they could, how to recycle what was possible, how to use alternative treatment technologies like steam sterilization, autoclave, instead of burning. All of this saved them money and improved their environmental performance. After a decade, there were less than 100 medical waste incinerators left in the United States. And we showed healthcare that we could use alternative measuring equipment to mercury devices to measure temperature. After a decade, we had completely eliminated the market for mercury thermometers in the US and had piloted mercury-free alternatives in Latin America, in India, and in South America. In 2005, we had a strategy meeting of all of our allies in Jaipur, India. In fact, we had a session at the Amber Fort. And then we came to Delhi and launched a global campaign with the World Health Organization to eliminate mercury from healthcare globally. We knew that eliminating mercury was, in India in particular, was key because mercury thermometers were still being manufactured in India, in places like Kodaikanal. The other critical country was China. So through a powerful mobilization of the healthcare sector and demonstrating practical success in substitution, we won the Minamata Convention in 2013, which committed the world to phasing mercury measuring devices out by 2020. And through this work, we built a global organization and a network focused on sustainable healthcare that now spans 72 countries and includes partnerships with the United Nations Development Program, with WHO, with the UNFCCC, and health systems and health ministries all around the world. And the key to success has been to bring the latest science on environmental health to the sector that is committed to healing, to show safer alternatives that could be implemented, and then to have the work be done by people, not in the name of Healthcare Without Harm, but in their own name, in their own institutions. Now we have awakened to a new reality. The reality of the climate crisis is here. The last 7 years have been the hottest years on record. We have already sentenced our children to a hotter world, a world where there'll be more extreme weather events, where there'll be more refugees, where there'll be more food insecurity, and a world where air pollution from burning fossil fuels is killing millions of people each year. According to a recent Harvard study, fossil fuel combustion alone led to the premature deaths of 8 million people in 2018, more than twice the deaths from malaria, tuberculosis, and AIDS combined. We've also learned that fossil fuel pollutants, just like dioxin and mercury, just like the toxins that continue to leak from the abandoned Union Carbide factory, these chemicals can impact the developing brains of children. They can impact neurological development. They can increase the likelihood of miscarriages and low birth weights. And of course, these emissions in highly polluted cities can damage the lungs of healthy children and adults, contributing to both asthma and heart disease. Unfortunately, unlike COVID, there is no vaccination for the climate crisis. It's the greatest public health threat we face. The only path to health is to quickly accelerate our transformation away from reliance on fossil fuels and toxic chemicals and industrial agriculture. The good news is that as we make this transition, we can clean up the air. We can detox our economy. We can support more sustainable agriculture. We can improve the health of billions of people. And we can ensure that renewable energy is a critical dimension of universal healthcare access. Climate solutions is at the very heart of health equity. So as health professionals, we have a critical role to play to engage our patients and our communities in understanding the links between climate and air pollution as issues that are fundamentally about our health. Research has shown that talking to people about climate issues as health issues is the most effective way to get people to care and to want to act. And health professionals, doctors and nurses, pharmacists are the most effective messengers for this information. So we have a critical role to play in this unfolding global drama. But beyond educating the public, we also have a responsibility to be advocates for policies to accelerate the transition away from fossil fuels. We can teach policymakers that energy policies are health policies, climate policies are health policies. Our policies to strengthen our health systems should also be climate smart and bring in the latest innovation and renewable technologies. And just like we demonstrated in the mercury story, that as healthcare eliminated mercury from its own facilities, that it led to a broader phase out of mercury, we need to kick our own reliance on fossil fuels to operate our health facilities. We need to kick our addiction to toxic plastics and other petrochemicals in our supply chains to model this crucial transition for the rest of society. The good news is that there's momentum happening. At the recent climate treaty meeting in Glasgow, 52 countries signed on to the COP26 health program, which commits countries to decarbonize their health systems and make them more resilient to climate impacts. India should sign on to this health program. Additionally, 54 health systems around the world, representing over 14,000 hospitals, signed on to the race to zero, including the entire state of Kerala, as well as the Aravind Eye Hospital in Madurai. We need more health systems in India and Pakistan and elsewhere to follow this same path and demonstrate what's possible. So I'll end with this observation. We need to decide in the next decade whose rights we are going to champion. The rights of the fossil fuel companies to continue to drill for more oil and gas and dig more coal and produce more toxic plastics, or the rights of our children to be born toxic-free, to breathe clean air, drink clean water as fundamental conditions for healthy development. As people committed to healing, as parents, we need to defend the rights of our children, the rights of children everywhere on earth. That's what the Hippocratic Oath is calling us to do. We need to center our values and our medical practice in the principle of first, do no harm. And that means stopping the air pollution that is killing us and the planet's ability to support continued life on Earth. Thank you.
Thank you so much, Gary. Thank you for taking us through that really wonderful journey where you actually put piece by piece on how you started with one focused initiative and scaled globally. And we, with Doctors for Clean Air, have been working with healthcare without harm and have firsthand seen on how you ensure the success, support the success, and promote your partners towards working towards the common goal of clean air and climate action. Thank you, Gary. Now I would like to invite Mr. Rajiv Khurana, Founder Trustee Langkare Foundation, to lead the next session and panel discussion on successful air quality campaigns and their impact, Voices from South Asia. Rajiv is a management consultant, a corporate trainer, an author, photographer, board advisor, venture mentor, and blogger. He has more than 42 years of experience in industry, has worked with hundreds of companies and corporate leaders across the world, and mentored thousands of students across India.
Thank you, Abhishek. Thank you so much for initiating it so well. It has been a real delight listening to Gloria and Gary. And in case, if I were to summarize in 5 points my ABCDE in terms of whatever they said, A, they set the alarm. B, they were talking more in terms of building and co-creating solutions. C, they were talking about collaborating for impact. And D, they were talking about dreaming, designing, and delivering a safer world for every breath that we take. And E, of course, in terms of enthusing, enabling, and empowering every stakeholder, because without their collaboration, nothing is possible. And of course, there is a bonus F. Failure is not an option for us. So my friends, if you have liked whatever Gloria and Gary has talked about, it's time now to use your fingers and give a smiley in the chat box or give a thumbs up so that we know that you are listening to them very well and you really, really appreciate whatever they have talked about. So here we are. The lines are open only for 10 seconds to put across your thumbs up and your smileys and your yes also in case you liked it. So I am now, the messages have started rolling in very fast and rapid, which shows that, wow, this has been a phenomenal success in terms of a great beginning. Thank you so much for doing all this enthusement for all of us. It's time now to change the gear. It's time now to move to our Nano Keynotes. This is the first time we are using the format of Nano Keynotes, 5 minutes, 4 international speakers putting across their ideas in a real packaged manner. I mean, to each one of them, we can listen to them for hours and hours together, but then they are going to be facing a humongous challenge of confining their ideas into a 5 minutes capsule. And my team is going to give them signals at 3.5 minutes and 4.5 minutes. So just keep an eye on the chat box so that you know how much time is really running out. And of course, our audience also has to participate now. So you can start asking questions, but questions relating to the theme only. Put your question in the Q&A box. I'll be reading those Q&A box. And in case you're actually participating from Facebook, please put a Q in front, write your question, mention your name, and rest assured your questions will reach me. But I'll be able to pick up only those questions which are pertaining to the theme. I may be in a position to just club some of those questions together. So kindly excuse me if I'm not able to take your name, but I'll try to deliver as many questions as possible to the panelists. And in case some of those questions remain unanswered, rest assured, Lung Care Foundation will ensure that your questions reach the panelists and they give an answer and we supply you the answers later on. All right, friends. So time now to move to our very first speaker. And let me have the honor of introducing Manjeet Dhakal from Nepal to be our opening person. He's a member of the executive board and former head of Clean Energy Nepal, a non-profit focusing on research-based education and advocacy campaigns on issues relating to sustainable energy use and environment conservation and clean air in Nepal. He's currently the head of LDC support team at Climate Analytics and advisor to the chair of Least Developing Countries. And he's also the adjunct associate professor for environmental management at School of Environment Science and Management, Pokhara University, Nepal. We are eagerly looking forward to listening to you, Manjeet. Over to you now.
Thank you very much. I really appreciate the format of the program, and will try my best to be with the Nano Keynote time slot. Let me share a brief experience from Nepal, a journey of the urban transport that is evolving, that is growing with the evolving technology. So about 25 years earlier, the capital city Kathmandu in Nepal has replaced the notoriously environment and the unfriendly polluting three-wheeler vehicle, which were known as Vikram Tempu, that were run by diesel, with the electric ones. And now these three-wheelers electric vehicle are called Safa Tempus that are still running in Kathmandu, serving as the Kathmandu's public transport need. So in 1995, these electric three-wheeler were first introduced in the country by the Global Resource Institute with the support of USAID at that time. But then the project successfully operated and they launched 7 of those vehicles and were handed over to the private sector in Nepal. The number of those Safa Tempu increased dramatically after that. And when the government took a decision later in 2000 to replace those three-wheeler diesel run vehicle with the Safa Tempu. So this also provides the best example of how the project support linked with the private sector can help to continue the activity. So the role of Clean Energy Nepal at that time, the founders of Clean Energy Nepal were mainly to help build awareness at the local level in the capital city, bring together public to advocate on the hazardous effect of air pollution, mainly because of this three-wheeler diesel run vehicle before that, and later also to help continue the improvement and ensure those three-wheeler clean vehicle run by electric get support from every sector of the society. Actually, the organization also formed because of all this campaign, when the founders at that time were getting together to ensure that the capital city is free, clean, and we have a new technology. We have electric vehicle at that time, and this was the time when the world was not having much of debate about the electric vehicle. So I'm pleased to have Mr. Bhushan Tuladar here, one of the founder member who were at that time involved in this campaign. So after that, we continued working with the different like-minded individuals in the organization in Nepal. Later, a network of the organization called Clean Air Network Nepal was established. Currently, Clean Energy Nepal holds the Secretariat of Clean Air Network Nepal. We work closely with the local government, with the federal government, with expert and NGOs and INGOs. Now this three-wheeler electric vehicle that contributed even to the establishment of the organization has grown to about 700 in Kathmandu. Yes, now with the demand and with the priority set for the public mass transport, the bigger vehicle, these small three-wheeler has been facing some difficulties, but still they look very appropriate in the context of Kathmandu, where we have a narrow street and in the elevation that Kathmandu is. So and on the other side, this has also a lot of potential to contribute to tap the Nepal's massive hydropower potential, replacing the import of the petrol and diesel that we have, which also contributes massively in terms of our annual fiscal budget. And the good thing is this use the peak hour electricity, because they basically charge during the night time and run during the day. The other interesting part about this is also this has contributed a lot in terms of the women driver who are running the supply temples. So also have contributed in terms of job and also the income generation. So as I said earlier, it sounds like these vehicles are still appropriate in terms of Kathmandu. So realizing this importance of this three-wheeler and to ensure the technology evolving with the time, we should help this three-wheeler. The Clean Energy Nepal, in collaboration with Electric Vehicle Association of Nepal, IBAN, with support of the REPIC from Switzerland, initiated a pilot project to do a feasibility test of lithium-ion power battery, because this vehicle were previously running with the lead-acid battery, whose efficiency was much lower. And the initial phase of the project recently, there was a support from the project to replace 3 of these three-wheeler with the lithium-ion battery. So during the project period, the additional 9 three-wheeler replaced their battery with the lithium-ion, and currently we have more than 35 Safa tempos three-wheeler that are operating in the lithium-ion, which helps to save energy. It's in terms of energy generation, it's double compared to what the lead acid battery was contributing, and also the life of the battery has increased, which eventually contributed to the income generation and also a number of other aspects. So there is so the good thing is still we have around little less than 700 Safa tempos that are in the street of Kathmandu. There is much to do. The team at Clean Energy Nepal are working closely with the broader stakeholders, the government, the local authorities, as well as national and international organizations, and also closely through the network called Clean Air Network Nepal. And this has also been now supported in terms of the target by by the government of Nepal when Nepal submitted its nationally determined contribution to the Paris Agreement, where the country have planned to increase the sale of electric vehicle, private vehicle up to 90% in 2030, and a public vehicle up to 60% by that time. So much to do, but with all this experience and support from the community, the team at the organization are leading this movement. Yeah, thank you very much. I'll stop here.
Wonderful listening to you, Manjeet. Thank you so much for picking up a specific case study in Kathmandu and talking about the three-wheelers and talking about the government's role in regulations, building awareness of the public, and the need for building appropriate solutions, including the technology solutions, so that the public is also served and the environment is also taken care of. We really appreciate your joining us and sharing your thoughts with us. Next on our keynote speaker list is our friend from Pakistan, Mr. M. Farhan Riaz. Farhan Riaz is a practicing and result-driven entrepreneur having more than 11 years of experience in the field of startups. That's quite inspiring. And he was trained in business incubation management from University of Queensland in 2015, followed by being the international visitor leadership program by the US Department of State in 2018, where he actually went through various incubation centers and learned the best practices. And he's playing an active role in Lahore and Faisalabad vis-a-vis the grid of low-cost air quality sensors to democratize the data for information, informed decision making of the citizens, and eventually better policy making, which is his focused thrust areas. Farhan, looking forward to listening to you, please. Thank you so much.
Thank you very much, Rajiv, and thank you, Mandeep, for the opportunity. I'm really honored to such amazing panelists, such beautiful insights. So anyway, I run a startup incubator in one of the oldest engineering universities of Pakistan. So in the context of startups, we have been working with United Nations Industrial Development Organization, where we promoted clean tech business plans and startups. So we have been working on that. We also have in our university, we also have a renewable energy park, where we are mainly working on not only producing green energy, but also to conserve energy, whatever we have at the moment. So ranging from electric vehicles to electric rickshaws to the efficient LEDs and DC motor fans to conserve the energy. Anyway, that's what we have been doing at the organizational level. But in the context of today's webinar, it started from an interesting story. One of my friends came from Canada, and he was unpleasantly surprised when he landed in Pakistan because of the bad air quality. It was like a shock to him. So some of my friends, they gathered together and started the movement. And later on, I joined them as well. And when my son was born, I was like, what kind of life we are going to pass on to our future generation? They cannot breathe properly because unfortunately, the air quality index and the rate at which it is deteriorating, Lahore and Faisalabad and other metropolitans, and particularly Lahore, would become uninhabitable. People won't be able to live there 4 to 5 years from now, God forbid, but that's going to happen. We cannot lend a blind eye to that. So inspired from those things, we founded a movement, and we call that Pakistan Cleaner Initiative. Anyway, it's 3-tiered. And I loved what Rajiv said, A, B, C, D. So we thought that alarm should have been awareness campaigns. Unfortunately, generally all around, and especially in our part of the world, we love to believe conspiracy theories. So first of all, we had to let the masses know that this is one of the rampant problem. It's kind of like a doomsday is just imminent, and we have to do something about it. For example, Gary mentioned, or Gloria mentioned, that it's like millions of deaths around the world. And the post-COVID, Corona is obviously very, very hazardous. And but in Pakistan alone, there have been 300,000 deaths last year, pre-corona I'm talking about, because of the bad air quality. And that's way more than the deaths by COVID. So I'm not at all undermining COVID, but what I'm trying to bring to the facts is that we are oblivious and we can lend a blind eye to the bad air quality, and which is exactly our first part of the movement, Pakistan Cleaner Initiative was aimed at, is to ring an alarm, raise awareness. This is one. The second effort of our initiative is to kind of democratize the air quality index and monitoring data. Because, for example, Lahore is pretty big. If AQI value in a particular place where I am right now is suppose XYZ, let's say 150. But it would be a sweeping generalization if we say that in the other part of the Lahore that we have the same AQI. It's not the fact. So what we did was to democratize. That brings me to my third part of the movement, and that is to kind of make indigenous and cost-efficient air quality index sensors for monitoring purposes. And the third is just kind of to firefight, is to run the air, make cost efficient and affordable air purifiers. And this is exactly what we did. At the cost of an exhaust fan, if you can get an air purifier in a developing country like ours, so that's like a big deal. But so this is how we had it planned. But and interestingly, we were doing that. So we got alumni small grant, ASG, from US Mission to Pakistan, which really helped us in kicking the awareness phase of our initiative to the next level. So what we did was we were planning a lot of seminars and workshops in person and physically in lots of cities. But because post-COVID, we had to halt our activity. So what happened was, it was blessing in disguise. What we did, we pivoted our campaign online, and we ran a lot of webinars. And mainly, a very interesting thing, I and Mandeep were having a chat a few days ago, and that was influencer marketing. The influencers on Instagram and TikTok, which is very popular these days all around the world. So those influencers, if they talk about it, they're going to get a lot of attention. That's what we need. So interestingly, if we would have carried out the seminars, we would have reached maximum 500 people with a lot of logistics costs, meals, and everything. But now we reached more than 10 million people around social media. And this is kind of the impact we generated. So there are a lot of other things that I would have liked to share, but I got the message that the time is over. So I love this concept of the Nano Keynotes, and keep up the great work. We'll be looking forward to the Q&A. We'll be driving by then, but thank you so much, Rajiv.
Wonderful listening to you, Farhan. And rest assured, nano questions also follow after the nano keynote. So I'm sure a lot of people are going to ask you questions. And of course, the things that you highlighted in terms of awareness, we face a similar situation because at Lung Care Foundation, we talk about 3 A's: awareness, awakening, and action. And the challenge remains the same. And challenge in the South Asian countries also remains the same, that we need to awaken people who are pretending to sleep. And that's the humongous challenge.
With your permission, just to add a few liners, as you talked about action. So based on the awareness we generated, we have collaboration with few of our government stakeholders, Environment Protection Agency and the Climate Agency, which I hope so, they might do something about it, but it's gonna trickle down. This is how it does. So at the end, they were just like, we need to pass on a good legacy. And in Urdu or Hindi, we call it Sans Lene Do. So thank you, Ji.
Wonderful. So I'm going to adjust this 1 minute into my Q&A. Thank you so much. On the lighter side, please. Time now to invite another wonderful speaker from Bangladesh. We have Essandroni. Essandroni is an environmental activist and founder of Green Savers, an eco-friendly organization that works on plantation of trees in Dhaka city and across the country. He worked with over 200 schools, 5,000 plus homes, and over 30 local and international organizations to fight climate change and create a greener urban ecosystem. We have also done the same thing, incidentally, in India. And beauty part is that the organization is also operating a tree hospital and mobile plants clinic. This is something we need to really learn more about it. So over to Ehsan for
Oh,
his
thank you.
Nano Keynote.
Thank you, Mr. Rajiv, for the nice introduction. And unfortunately, I'm not a good speaker, but I'm sure that will not impact to decrease the air quality, I'm sure. And it's my really honor to share my screen with Honorable Farhan from Pakistan, Mr. Gary from USA, Manjit from Nepal, Sitan from India, and of course, the founder of Lung Care Foundation, Mr. Rajiv Khurana. Thank you, and US and American Center India and American Center Bangladesh. Thank you all for giving me the floor to participate in this such a prestigious program. When I start this initiative, the air quality initiative, this is back to 2010. At that time, I live in the city, the capital, which is the worst densely populated city in the world. When I came to the capital city, Dhaka, for my higher education in 2010, I experienced that I had the cleanest air to breathe in my village. And when I entered the capital city, I found that there are a treeless city. The city, the air with dust, particles, and many other pollutions everywhere. Because of the development process, new city building process, a lot of infrastructural development were going on at the time. So that was a new experience for me to cope up with the city environment. And then I started thinking, how can I properly cope, or how can the new generation can cope up with this environment, as I had the both experience from in village and the capital city. Then I came to know that, then I start learning from internet, that is, what is the reason behind this? I came to know that the urban heat island impact is the catalyst for destroying the air, decreasing the air quality. Then I thought that what I can do as a young university student, as a sophomore, what can be done by me or my mates. Then I thought that there is no space in the city. All our mushrooms-like building, in Dhaka city, more than 500,000 building in a very small city. So so only the space is rooftop. If I want to plant trees, then I have the only option that I can use the rooftops, the open rooftops, because in 500,000 building, there are more than 500,000 square feet areas where I can be green. That can impact, that can be added as added canopy or leaf area surface to combat the climate change at the time, or improve the air quality. Then I started knocking my relatives and the city dweller. But at the time, the concept, the rooftop garden was not that popular to the city dweller. And there were some stigma or some wrong conception, that is rooftop will be damaged, rooftop will be in danger. So they didn't even bother to my words. And I at the time I didn't have that capacity to reach each and every building owner. So I was thinking, what can I do? I tried to enter many buildings owner, but I was refused badly. Even I couldn't enter the main door, the main entry door, with the security guard. So I thought that I have the solution. That is, if I can green all the rooftops, then that can be an impact. but I cannot even access the security gate of the building. So how can I enter? How can I convince that city dweller that we have still an option to improve the air quality, to improve the decrease the temperature. Then I started talking to the schools. That is, when I started talking to the school teachers, headmaster, that is, I want to share my experience, my thinking, and I want to play with the kids with some farming tools, some plantation techniques that I have experienced from my village, so that they can, your school can be green. They will grow green and decorate your school by greening this by themselves. Then some schools allowed me to take a seminar workshop. Then I started spreading the empathy to the school students that you can spread, you can be a torchbearer to make your city green. So I started giving a plant and telling them, this your pet plant, love this plant, give water in this plant, then this plant will talk to you. This plant will make your city green. And in this process, we started oxygen banking in the schools. We set up a bank in the school and tell them, save something from your tiffin and put it in the bank. So after a month, you will collect all the coins and buy plants and decorate your school's favorite gifts. Give plant to your teachers, your favorite friends. At that process, they started becoming a plant lover, and on that process, then I started telling them, you can also do this gardening to your building. Tell this to your parents, so that they can do this to their residents. And on that process, we started getting entry to the by my students. We started getting entry to the city dweller, and when they started connecting me, then I started rooftop farming to the city buildings. And after simultaneously, when I started rooftop farming in the city, we thought that only rooftop gardening is not a sustainable solution. Rather, we have to maintain this properly, and we have to select the plants that improve the air quality, that are that improves that can absorb dust, that can purify the air purifier plants. So we started introducing the air. We started the plants, introducing plants that improve the air quality. And simultaneously, to maintain the plants, maybe I'm taking much time, I'm sorry. So that's the process. We have made for a lot of rooftop garden. These are now, then we started hydroponics. So also water is improving the air quality simultaneously. And thank you very much for patience hearing me.
Thank you so much, Hassan. This has been, again, wonderful listening to you, that as a young man, you did not think in terms of blaming everyone, but you took up the charge by aiming something. And this open rooftop solution was fabulous. Working with school is great, because we also have the similar experience through our best clubs, Breathe Easy State of Clubs in school. And now with colleges, we are now working on ACT, Air Pollution and Climate Change Task Force. The power of the youth is immense in terms of bringing about these change, and making them as plant lovers is a fabulous dream that you have nurtured, and it's very inspiring. Thank you once again. And it's time now to bring our own Chetan Bhattacharjee. Chetan is a senior managing editor at NDTV 24/7, one of the leading news channels of India. He's on the governing board of Care for Air, a Delhi-based advocacy group on air quality. He's a man of few words, but talks immensely well. He has led reportage on India's air pollution crisis, as well as research and written about policies on this. Chetan, we are keen to listen to you.
Thank you very much, Rajiv, for your very kind words and generous introduction. Got quite a few points to cover. Fortunately, a lot of them have already been made. So let me begin by acknowledging a couple of things. One, I think Gary said it really well when he said that climate policies are health stories, and they should be pitched as such. They should be focused and announced and debated as such. The second thing is that at the moment, there is a massive gap, and we've seen this for several years, between science and policy. There's a mountain of science which shows us what all we should be doing, but the policy seems to be lagging behind it. I must also acknowledge that a lot of policy actions have been taken, like, jump starting to the cleaner fuel standards and the Ujjwala gas scheme. But as we saw just a couple of months ago, the levels of air pollution are still terrible. We also have to acknowledge that something like over 3 deaths a minute are taking place, and these are linked to air pollution. So the crisis is probably growing, in my estimation, because there are no signs of levels actually coming down, even though there are some reports that in some places the levels are reducing. But overall, we see it year after year that there are very high levels of pollution. What I would like to do, and what your brief also suggested, is to go over success stories on narratives that have shown what the way can be in communicating this air pollution crisis and solutions to it. I would like to recount a couple of experiences that we have actually gone through at NDTV, at my news network. And one of them is just the simple task of reporting the air quality data. This we started doing pretty soon after the government launched the AQI. Now, even today, not many people really know what AQI is or what it really means and how it works. But what that number started doing is sort of connecting the number and what people was going through, the health of their children, the health of their parents, their own health, what they were going through. They started developing a correlation. So now, for the last 4 or 5 years, we've been regularly reporting this. And by regular reporting, I mean putting it out every hour or continuously, because this data is now live. There's a demand for this. Now, how do we know there's a demand for this? Because it's not usually a headline, but we get sponsors for that. And we've been getting sponsors on a regular basis for a long time. So that's one thing that has actually worked out, that we've seen that there is a demand for good, solid data. And this is all government data. This also ties in with what Farhan was saying on the whole, on the vast network of low-cost networks. I think that's going to be the next phase, where we should be tapping into that and reporting that on a large scale, and to use your phraseology, at nano levels also. Nano levels means in my district or sub-district, or in one particular part of my state. However, I would like to devote the remaining time that I have, about 1.5 minutes, to one big success story that we saw. And that was, for the last several years, we've been on the lookout for covering reporting on air pollution in all across India. And as a part of this, somebody reached out to me from Bangalore to say that, in their neighborhood, there's this group which has been fighting a battle against an industry, a factory called Graphite India. Now, Graphite India, they noticed, not through any government monitoring systems or official pollution control board monitoring systems, but through their own data analysis, through their own devices, air quality monitors, they figured out that this particular plant was polluting a vast neighborhood. So we did a story on it. We put it and positioned it on prime time. We got the citizens group, which was behind this driving for change, pressing for the closure of the factory. We got them on. I think it was early October of 2018, if I'm not mistaken. We created that platform. Within a couple of weeks, within maybe, I think, a couple of months, actually, the case was taken up in the Supreme Court. It was bunched together with a lot of other cases. And within 6 months or 8 months, perhaps, that factory was actually shut down. It was because of the citizens group. I can't say that our network took credit, can take credit for it, but we did provide a platform to amplify this immense operation that the citizens group had undertaken. And what they noticed is that within a year, the pollution levels, the PM 2.5 levels had actually come down. Now, what this story tells me is that it is possible for an intersection of media, science, data, and most importantly, citizens to come together and actually bring forth some kind of change at the local level. And there's such cases all over India. There's a very active citizens group in Gurgaon, I know, which is neighboring Delhi. Plus, there are several in Delhi and in other parts of North India. So I see my time is up, but I would like to leave this thought with all our participants and our visitors to see that, how can we drive change at a citizens level as well as along with institutions like the media and local government. Thanks, Rajiv.
Thank you so much, Chetan. In fact, I must compliment NDTV for giving a lot of phenomenal coverage on air pollution, and you specifically for leading the fight also, which is quite inspiring for others. The gist of what you're saying is we need to bring all the stakeholders together, both classes and the masses, to work towards a solution, because and television vis-a-vis news and views plays a very vital role. Keep doing a great job and keep guiding others also, so that we all can come together and create the rightful impact in India. So friends, you've just seen brilliant speakers sharing their experiences and inspiring action ideas, from rooftop gardening to solutions of transportation in the city, and how collective momentum can impact. I think you need to recognize their efforts by giving a thumbs up or a smiley, or saying, yes, you liked it. And I give you just 10 seconds for that. Use the fastest fingers first, give the compliments, and then we proceed further, because it is very important to celebrate the good thoughts we generate together. It is very easy to criticize, but it is very, very important to compliment people who are working together. And by complimenting, you are also conveying something very important. When it comes to your task, your role, you are going to be playing a very important and significant role in bringing about these changes. And that's it. And I must compliment you, friends, for all this. And now I'm going to involve you. I'm going to pick up some of your questions. And at the same time, I'm also going to give you an exercise. I have a poll designed for you. So use your fastest finger first. You will get only 60 seconds to respond. And let me see how fast you respond, so that your collective thoughts come together in the form of a poll. So look at your screen, and I am going to be sharing the poll before you. So here we are, my dear friends. The poll is being launched. Says air quality, communicating for change, the audience poll. Question number 1. I received communication on air pollution through print media, electronic media, social media, emails, all of the above, none of the above. Just pick up one answer. That'll be wonderful. Second, I wish to know more about air quality news and views, air quality and climate change actions, air quality and health impact, air quality and its impact on economic progress. All of the above, none of the above. You're already a very informed person. Question number 3, very quickly. In my opinion, communication relating to air quality needs to be improved in the following segments: transport systems, industry, power generation, renewable energy, research and monitoring. All of the above, none of the above. In case you feel there's something else, do point it out. And one more thing, would you like to collaborate with any participating entity to support the initiatives on air quality in your country? If your answer is yes, we will have a link given to you at the end. Just fill up the form before you exit from this discussion and share your interest, and we'll make sure that your data is shared with the respective organization being represented here. We have so far 48% response, which is pretty good. 50% has already crossed. This is the current polling scenes in India also. Roughly 50 to 60% polling happens. We have crossed 55%. That's a good speed. So I can extend the time by another 10 seconds so that you can finish off all your replies and responses, and let us see what is the result that appears in front of you? And these are the figures you are generating, and these figures are going to be very vital in terms of sharing with those who have not attended this session, but I am sure they'll find it very, very useful. 60% we have crossed. So now the last 10 count. 10, 9, 8, 7, 6, 5, 4, 3, try it fast, 2, 1, and at 62% respond, let me end the poll here, 64% response. And allow me to share the results very quickly. The results are, I received communication on air pollution through print media 3%, electronic media 10%, social media 25%, and that's been experienced. Social media is really creating a major movement. Emails 8%, all of the above 43%, none of the above 10%. So that's a major concern, none of the above. I wish to know more about air quality news and views, 3%. Air quality and climate change actions, 22%. Air quality and health impact, 15%. Air quality and its impact on economic progress, 3%. All of the above, 57%. None of the above is none. Glad to know that. In my opinion, communication relating to air quality needs to be improved in the following segment. Transport system, 18%. Industry, 5%. Power generation, 2%. Renewable energy, 5%. Research and monitoring, 7%. All of the above, 63%. That's good. And of course, in terms of your keenness to get involved, 75% have admitted that they would like to be involved, and 15% are not sure. So please, at the end of the session, fill up the form and we'll make sure that your information reaches everyone. So my dear friends, let me just stop sharing it and move to picking up some of your questions. And you've done a fabulous job. Absolutely fabulous job. So let's do a small exercise. Raise your hand and pat your back for being a wonderful audience and a wonderful participating audience. Time now to ask some questions to our panelists. And the first question, of course, is common for all the panelists. And this question I picked up by combining a couple of the questions from the Q&A chat. The question is, we all need to do at an individual level, at a stakeholder level, but how do we catapult very strongly in terms of air pollution to convince the government, and not just the central government or the state governments, but even the city governments, to take charge of the air pollution and work along with the public? So kindly quickly think in terms of what has been your experiences in your country and talk about what you think should be done so that we all can learn from each other. 1 minute answer from all the panelists, please. Okay, anyone can start. And Gary, we would also love to hear you also in this, please.
Our experience is that the combination of engaged citizens, like Chetan talked about, partnering with health professionals and other influencers, and also progressive businesses that are going to benefit from this transition away from polluting industries to greener industries, to healthier industries. The combination of the health case, the economic case, and citizen power has been influential in many situations, like the one Chetan talked about, but hundreds around the world now, where citizen activism has fundamentally changed. And it's often the last place where policy is made is at the government level, where they hear it, but they need to hear it from people that are trustworthy, and health professionals are trustworthy, and entrepreneurs are trustworthy, and citizens who are being impacted are trustworthy.
Thank you so much, Gary. Manjeet, would you like to add to that, please? And I'm looking forward to listening to Farhan and Hassan. We are running against the time, so we may not be able to take too many questions.
Thanks. One of the experience from Nepal has been the event that cleaners in Nepal, the International Center for Integrated Mountain Development, ICIMOD, and the Kathmandu Metropolitan City and the Lalitpur Metropolitan City of Kathmandu Valley, who have been organizing the Mayor's Summit. the mayors of the Kathmandu Valley, bringing them together and discussing on the major environmental issue and mainly focusing on air pollution. So we have set a 3 summit as of now every after certain interval, where they come together, discuss with experts, private sector, and also academic. And a number of occasions they have come up with the commitment to and a declaration, and those commitment has been realized to some extent. For example, the Lalitpur metropolitan city in the Kathmandu Valley has started paving a road for bicycle lane, and there has been a lot of other initiatives in the neighboring metropolitan as well. But there is much to do. But this one initiative has helped to bring together mayors to develop understanding and to work together hand in hand. Thank you.
Wonderful, wonderful. And let me ask Ehsan. Ehsan, could you give me a 30-second answer, please? I'm really running against the time. And we finish on time always.
Sure.
Yep, Ehsan.
Yeah, can you hear me?
Yeah, you can. Go ahead.
Yes.
Ehsan, we can hear you. Please, go ahead.
Thank you. Thank you. What can be done in terms of Bangladesh, if I can tell you, that is, in Bangladesh, the young generation are more involved. In any city, anywhere, young generation can bring about change very easily. So anywhere, in any way, if young generation can step up, many idea can bring about. Many idea can bring many changes. So maybe not the same way, but in a different way, but in a better way. So let the young generation take the chance, take the risk.
Wonderful, wonderful. Farhan and Chetan, would you like to give a quick bite? Now the time is 15 seconds each, or 20 seconds, please. Go ahead.
Sure. Can you hear me?
Yeah.
All right. So in our case, as I mentioned in the last comments of my Nano talk, that we kind of raised some awareness, and through some connections, we had a few meetings with the government stakeholders, environment protection agencies, and some climate control guys. So unfortunately, they were pretty much clueless. It shouldn't have been the case, but they knew the buzzwords, but they didn't know what were the implications or how to kind of tackle that. So with a lot of dialogues we have had with them, we have been able to install 5 of our air quality index monitoring sensors in different parts of the city. But again, as big the city Lahore is, 5 is nothing, but maybe it's just a good start. So I would say, just to conclude, lobbying on social media might kind of corner and force the government to do something about it. And yes, as the younger generation and the other participants are saying. So thank you.
Chetan, quickly share the power of media in terms of awakening the government. To what extent you have been successful?
The power of the media is quite powerful, because I think what has happened in the last few years is that, especially in peak pollution season, there are front page headlines, primetime headlines, and a lot of coverage devoted to this. So I think the governments do react. I think it's so far a knee-jerk reaction, although there are some efforts for long-term impact also. And I would like to quickly add in conclusion that in the last couple of months, we saw power plants being shut down, big businesses being shut down. Now, these are drivers of the economy. And if air pollution is shutting these down, I think that was an inflection, landmark moment in our battle against air pollution. So I think there is a momentum, as other speakers have said, and I think social media is going to add to that momentum, as well as, of course, the media.
Wonderful, Chetan. Thank you so much. In fact, I'm taking the liberty, because I got 3 requests. Sir, can we extend the discussion? Because this is a real live discussion which is happening. So 5 minutes only, I'm extending it so that we can take one more question from people. And these questions have come up in front of me. I'm trying to club many of these questions together. But one question where all 4 countries face the problem is houses are small, people are poor. There is an ambient air quality which is bad. The indoor air quality is worse with the kind of cooking mediums also which is used. What do we need to do to create and strengthen the awareness and awakening so that even the elected representatives start working for the people, and people also start demanding that every breath they take actually counts, in case the elected representative need to also make sure that their votes count? How do we create that and strengthen that awareness so that this becomes a huge moment through communicating on air pollution. The panel is open. Please quickly and 20 to 30 seconds answer. And anyone can take the mic and start, please.
Yes, I think urbanization is a process, is an ongoing process. So with the pace of urbanization, the people of urban should own urbanism, should own the city, should own his city, the practice of urbanism. If they can take the ownership, then definitely he will make some responsibility in him, and definitely he will be conscious and concerned to his responsible behavior.
Thanks. Manjeet, quickly.
Yeah, so one of the examples from Nepal could be the linkage that we have established with the threatening problem like climate change. So with my current affiliation at Climate Analytics, which we are working closely with the government, the target that Nepal has set in its current climate change plan includes setting up a standard for industry in terms of reducing the pollution, promoting electric vehicle, the vehicle fitness center. So here we have tried to club together the major issue, which gets a lot of attention at the higher level and at the political level. And this issue is very important as Nepal will be running for the different level of election from federal to the local level. So much work to be done in our context.
Thanks, Manjeet. Farhan, we are very keen to know about the Pakistan experience because the situation in India and Pakistan remains almost the same.
Looking at the time constraint, I believe green technology, clean tech energy is the answer. We cannot do that right away, but fossil fuel going electric is the future. But other than that, there are a lot of, in the wake of urbanization, we cannot stop cooking and stuff, but we can stop burning the crops, as what happens in our part of the world, in India and Pakistan. So awareness is the other second tier solution, I would say. So thank you.
Chetan, the problem in India is humongous.
Yes, it is humongous. It is humongous, but the good thing is that we already have a policy, the Ujjwala scheme, where LPG cylinders, cooking gas cylinders are provided. The flip side is that program seems to be floundering. They are not enough. The poor can't afford to refill those, so they're going back to their polluting methods. But the fact that has been done means that a lot of awareness has already been created in households where probably media would not have reached,
Sure.
not the conventional news media, and definitely not social media. So there is a lot of awareness. So I think this is a good time. It may not look very good in terms of the actual levels of air quality and the health repercussions, but I think a period of change has begun, and this is when experts, health experts, scientists, doctors, and of course the government and influencers can actually step in, start talking about this, and amplifying and pushing for a continuation of this change.
So that's quite reassuring. Gary, your concluding 30 seconds remarks, please.
I think we need to internalize those external costs in which we're paying with our health for fossil fuels. Those are not in the price of fossil fuels. They're not in the price of coal, but we are paying with our health. So we should stop subsidizing those industries that are poisoning us and start subsidizing the industries that are going to provide the clean cook stoves, the renewable energy strategies, the clean tech strategies that Farhan and others are creating all across the subcontinent.
Wonderful, Gary. Thank you so much. So my dear friends, this has been a real wonderful session, and our participants have really given us some good insights from their respective country. Time now